Numerous studies have shown that trained dogs can detect many kinds of disease, including lung, breast, ovarian, bladder, and prostate cancers, and possibly COVID-19 simply through smell. In some cases involving prostate cancer, for example, the dogs had a 99% success rate in detecting the disease by sniffing patients' urine samples. But it takes time to train such dogs, and their availability and time is limited. Scientists have been hunting for ways of automating the amazing olfactory capabilities of the canine nose and brain in a compact device. Now, a team of researchers at MIT and other institutions have come up with a system that can detect the chemical and microbial content of an air sample with even greater sensitivity than a dog's nose. They couple this to a machine learning process that can identify the distinctive characteristics of the disease-bearing samples. The findings are published in the journal PLOS One. The researchers say it could someday lead to an automated odor detection system small enough to be incorporated into a cell phone. Dogs, for now 15 years or so, have been shown to be the earliest, most accurate disease detectors for anything that the researchers have ever tried. So far, many different types of cancer have been detected earlier by dogs than any other technology. The dogs apparently pick up connections that have so far eluded human researchers. When trained to respond to samples from patients with one type of cancer, some dogs have then identified several other types of cancer, even though the similarities between the samples weren't evident to humans. The researchers over the last few years have developed and continue to improve on a miniaturized detector system that incorporate mammalian olfactory receptors stabilized to act as sensors whose data streams can be handled in real time by a typical smartphone's capabilities. The research team envisions a day when every phone will have a scent detector built in, just as cameras are now ubiquitous in phones. Such detectors, equipped with advanced algorithms developed through machine learning, could potentially pick up early signs of disease far sooner than typical screening regimes, and could even warn of smoke or a gas leak as well. In the latest test, the team tested 50 samples of urine from confirmed cases of prostate cancer and controls known to be free of the disease, using both dogs trained and handled by medical detection dogs in the UK and the miniaturized detection system. They then applied a machine learning program to tease out any similarities and differences between the samples that would help the sensor-based system to identify the disease. In testing the same samples, the artificial system was able to match the success rates of the dogs, with both methods scoring more than 70%. The miniaturized detection system is actually 200 times more sensitive than a dog's nose in terms of being able to detect and identify tiny traces of different molecules, as confirmed through controlled tests mandated by TARPA. But in terms of interpreting those molecules, it is 100% dumber. That is where the machine learning comes in, to try to find the elusive patterns that dogs can infer from the scent, but humans haven't been able to grasp from a chemical analysis. This achievement provides a solid framework for further research to develop the technology to a level suitable for clinical use.